Okay, so just a quick review. So we got this big pile of money, stack of ones, reaching all the way from the Earth up to the moon. That's $3.5 trillion. That's how much we spend through the government every year. And we spend about a quarter of it on defense, a quarter of it on Social Security, a quarter of it on Medicaid and Medicare, and about a quarter of it on everything else the government does. We also spend about $1 trillion more than we take in. We spend 3.5, but we take in 2.5 trillion. And that extra $1 trillion that we spend that we don't have, that's our deficit. Every year we go another $1 trillion into debt, adding to our $16 trillion national debt. That's the basic situation. And if we're serious about reducing the deficit, we got to come up with $1 trillion solutions, because these are $1 trillion problems. So where do we get $1 trillion from? Well, you could get it by just lopping off one of these big limbs of the government, right? We could lop off defense. That would save us $1 trillion, but we'd have an undefended country. We could lose Social Security, right? Just not pay it, but it's not our money. People pay into Social Security their entire working lives, and they get to collect their own money when they're done. That's the deal. What about Medicaid and Medicare? We could just stop paying that. But it's the cheapest way we've figured out to pay health care for people that we're going to have to pay it one way or the other. Every society has young people and old people and sick people and hurt people and crazy people that can't work. And you have to take care of them. You don't want to have a bunch of babies and retirees with pitchforks. It's cheaper to pay preventative and primary care for people. When you go to the dentist and you have a filling, you get it filled, and it costs $100 or $200, that was the cheap way to do it. You could have waited until it became an abscess and an infection. You need a root canal, but that's way more expensive. $200 is way less than 20 grand. So we do Medicaid and Medicare because it's cheaper to do preventative primary care than it is to do emergency radical care. What about cutting all the rest of government? Cut NASA, cut justice, cut transportation. But you'd have to cut every single department completely out of the budget to save $1 trillion. And then we'd have rats in our food and lead in our toys, and we wouldn't get all the benefits that government research gives us, like the internet. These little innovations that government comes up with that the private sector then develops and turns into giant drivers of our economy. So we're not going to be able to cut any one of these things completely, or even appreciably. But maybe there's something that we could reduce costs on that's too expensive. Like, say paper clips cost too much. Say they cost $1 billion each. And if we reduced paper clip prices, we could save money throughout the government. Every branch of government uses paper clips, and even every family uses paper clips, and every business uses paper clips. So if we could reduce paper clip prices, we'd save a tremendous amount of money. But paper clips are cheap. What's not cheap? Healthcare is not cheap. Healthcare is the biggest item in our federal budget and in our family budgets, and that businesses pay for. Healthcare accounts for 17% of our gross domestic product. That's everything we make and do in a year in this country. $15 trillion roughly. The entire economy, 17% of that goes to healthcare. That's more than twice as much as any other country on the planet. And if you could reduce healthcare costs substantially, you'd not only reduce the deficit a lot, but you'd unburden families, you'd free up businesses to hire people. Is there room to cut costs in healthcare? Maybe it's just worth it. Maybe 17%, maybe $3 trillion is just how much good healthcare costs. Well, it turns out there's a tremendous amount of waste in healthcare. And I'm going to show you a little chart. Here's waste. We spend about $250 billion on unnecessary care, $150 billion on fraud and abuse. Looks like another $200 billion on administrative and hospital inefficiencies, another $100 billion on uncoordinated care, doctors not talking to each other, and avoidable care. So all told, we're looking at almost $1 trillion just in waste. That saves our government maybe $500 billion, it saves the private sector $500 billion, but that's not all. We also spend too much. Even if we didn't do any unnecessary procedures, the procedures that we do are still way overpriced. Here's another chart. This is a bunch of different procedures you can get in a bunch of different countries, and we're talking about countries with really good healthcare systems like Japan and Germany and France and the UK and Canada, world-class healthcare systems. These red dots are our prices. The gray and blue dots are everybody else. You notice that for almost every item, our prices are about twice as much as even the highest priced next person over. You might have an operation in our country that costs 14 grand. That costs 9 grand in Canada, $7,000 in the UK or in France, and $3,000 in Germany. And these are comparable operations. Germany has some of the best healthcare in the world, some of the best doctors in the world, some of the best equipment. Think about the difference between a BMW and a Chrysler. But they charge 3 grand for a procedure we charge 14 grand for. But that's not all. We're also not the healthiest country in the world. We have high infant mortality. We have low life expectancy. We're not even in the top 20 for life expectancy. If we were healthier, we could reduce healthcare costs even more. When you're healthy, you don't need healthcare. I always think about Jane Goodall when it comes to this stuff, because she used to take a handful of raisins, probably still does, into the jungle and hang out with the chimpanzees in Gombe all day long. How productive has she been? How much has she contributed to the world? And how little is she consumed? How healthy is she? No angiograms, no CAT scans, just a handful of raisins. And she's doing something that she's so psyched to be doing all day long, every day. To me, that's health. What would it look like for our country to have 300 million Jane Goodalls running around? How much would we save in healthcare? So, reduce waste, lower prices, and increase health. If there's a magic bullet to reduce government spending, maybe eliminate the deficit, free up families to spend on other stuff besides healthcare, and unburden businesses so they can actually hire more people. If there's a magic bullet, it's healthcare. Now, what if somebody were already looking at these numbers a long time ago? And what if they realized that the number one most important thing to deal with for the economy and for jobs and for the deficit was healthcare? Wouldn't it speak well to their wisdom that they knew what the right thing was to tackle? Wouldn't it speak well to their persistence that they actually got it passed with an obstructionist Congress and a very powerfully and strongly opposed healthcare lobby? Wouldn't it speak well to their leadership and to their patriotism that they tackled something that they wouldn't get much credit for, if any? They put the national interest above their own political interests. And what if that person's spouse was working on the other half of the problem, trying to increase health in the country? What if the overall impact of that could be to reduce the cost of healthcare in our country from an outrageous $3 trillion a year to a much more manageably insane $1 trillion a year? Wouldn't that team be kind of on the ball? And what if we were on the ball enough to have elected that team 4 years ago? I'm just saying, this was the right thing to tackle. This was the one thing that could not only address the deficit, but also address consumer spending and job creation. There's nothing bigger. I didn't know that until a week ago and I started looking at these numbers, but everybody should know this. Tackling healthcare is tackling the economy and jobs. Now I want to show you one more chart. This is healthcare spending as a percentage of GDP. Here we are, 17%, but also per capita. $8,000, more than $8,000 per person we spend every year. The nearest closest country is about $5,000, Switzerland, and then it goes down, $4,000 for most other countries or less. Now look at this green line. That's public spending. That's government dollars going to healthcare. Notice anything about that? Look at our line here. We spend more federal dollars on healthcare than anybody else in the world, including Canada and the UK and France and Germany and Japan and all these other countries that have socialized medicine. We have the largest single-payer system in the world. Already, we spend more per person just through the government than any other government does on the planet. But we get less bang for our buck because we're getting ripped off. It's not that complicated. We'd be able to cover everybody in our country for the same amount we already spend. Just eliminate the rip-off factor, price gouging and unnecessary procedures, profiteering. Just that. We're not talking about perfect. We're talking about just as corrupt as other countries, just as fraudulent and overpriced as France and Germany and Switzerland and Canada. For what we spend right now, we could have the best, most advanced single-payer system in the world. That's good to know. But whatever you think about this president and this policy, one thing is for sure. Healthcare is the most important thing to address. Hands down.